thank you very much for joining us on this webinar, which is part of our uh, Trendsetter webinar series from Cassie Insight. So today I have Ms. Ukiri Simbo, who's the CEO of Avon Healthcare from Nigeria, joining us. I'm very happy and very excited to have her today. And we will talk about, her experience. We'll talk about, what's happening with COVID, and we'll talk about the future and getting some insight from her. So to begin, I would let Ms. Ukiri introduce herself to our audience. Over to you.
Thank you. It's a real pleasure to be here. Thank you for having me. As you said, my name is Adesimbo Ukiri. Everybody calls me Simbo, so I'm quite glad that's what you picked on.
Okay.
And yes, I am the CEO of Avon Healthcare Limited, based in Lagos, Nigeria. We have operation across the country. It's a health insurance, health management organization. We've been in existence now for about 8 years. And it's been quite an interesting journey, and I'm glad to be here to share our insights with you.
Thank you. So, let's start with your experience, your own experience getting into the healthcare space and getting into Avon. I saw some videos from you online, and you have quite an interesting background, and I would like you to share a little bit about it to our audience, please.
Okay. So I'm not sure whether you mean my background as a person or Avon HMO's background. So which one were you specifically referring to?
Your own experience, right?
My own experience.
Coming into Avon, what you've done in the past, and yeah.
Okay. So yeah, my experience has been quite a journey. I started off initially, studying law in the university, and then going on to work in financial services. I worked in banking, corporate and investment banking to be precise. And then I worked in FMCG, I worked in oil and gas, did a little bit in consulting. Actually, I also worked in telecoms, but always in revenue facing, customer facing, revenue generating kinds of roles, business development kinds of roles, marketing after a while. And I found myself in healthcare about 10 years ago, and I've stayed put in healthcare since then, which is quite unusual. But I must say healthcare provides the opportunity to both, do good, have impact on people's lives, impact that is meaningful, that you can see on a day-to-day basis, and also so much room for growth.
Yes, absolutely.
So much opportunity to still do new things every day. And to innovate and to create. And Africa is fantastic for that. So I'm not surprised. I'll probably still be in healthcare for a long time.
For a long time. And this is very, very timely as well, right? We in the midst of a pandemic, right? As we all know, COVID has hit Africa as it has for the rest of the world. To be honest, Nigeria now, I think we have about 47,000 cases in Nigeria. Few deaths and a lot of recovery, which has been the case for a lot of the countries in Africa. So, how has COVID impacted you personally, as well as your business, which is Avon?
Yeah, in healthcare, COVID has been a kind of a mixed blessing. It's been a tragedy in many ways for everybody, because the whole country suffers from it. Society suffers from it. We can't go out the way we used to. Economic activity is seriously hampered, and that's hard on everyone. But it's made us all slow down and appreciate ourselves better and appreciate life better. It's made us all question what's important to us on a deep and personal level. It's cut off excessive waste. Oh, sorry, that's kind of repeating the same thing. It's cut off waste and excess in our lives. It's made us all strip away what is unnecessary and look at the core of what we're supposed to be here to do, or what we really, really should be doing. And that's the same on an individual level as it is on a corporate level, as it is, I think, to an extent on a national level as well. If I bring it to us as a company, we've all had to work remotely. You know,
Yes.
for about 3 months, the whole country was on lockdown, and we had to work from home. And in a way, it's eliminated unnecessary spending in the office. You know, of course, there's cost efficiencies everywhere.
Yeah.
A lot of companies that were averse to remote working before have seen that actually it's not a bad idea. Why do you need to have everybody in the office and physically monitor what they're doing?
And giving the
So there's a
traffic
lot
in
of
Lagos.
exactly with the traffic we have, the commuting time. So it's that's just giving everybody another way to look at how productivity. Cost of diesel, everybody knows power is such an issue in Nigeria. You know, you have the generator running almost the entire day to support what is going on in the office. I mean, do you need to have all of them there? How many people do you need? So how much diesel and how much of, you know, generating power do you need to personally, well, as a company, do you need to have to keep people in the office? In addition to that as well, look at the roles that you even have in your office, you know, and you can see, because now they're working from home, each person's output is so transparent.
Absolutely.
It's much easier for you to see, because now nobody, it's harder to hide under it's taking time because you're waiting for somebody else to finish working on some other thing. It's just simply now down to where's the output at the end of the week.
Exactly. Yeah.
You know, so in that way, that's why I say it's kind of a mixed blessing, because it's making everybody strip away what's absolutely unnecessary. They're stripping away the fluff, and you're just getting at the core substance in every which way you can think about it. And also, you know, it's disrupted the global supply chain, and that also has to do with health consumables as well.
Yes.
Now we have companies in Nigeria that are manufacturing PPE. Every country has had to start looking inwards.
Absolutely.
And, you know, investing in its own healthcare value chain. You know, and not just the healthcare value chain, even on the supply side, investing in hospitals. Most countries have had to set up emergency isolation centers. They're now seeing that, oh, we can't all hop in a plane and fly abroad when we get ill.
Yeah.
You know, so it's in many ways it's been a mixed blessing.
Absolutely, absolutely.
That's why I said what I said, that it's a mixed blessing. It's tough, it's hard, it's a tragedy, but hey, there's some good coming out of it.
No, that's very, very interesting. And I think, you know, we'll talk about it a little bit later, but, you know, going into the future, looking at the new normal, what, you know, what's going to happen, you touch up on a few things that are, you know, interesting trends, you know, around the future of work. Like, what does that mean for the continent, right? You know, you touch upon, you know, what's essential, which is one of the trends that we're also seeing in our own research, as to the shift in terms of what's essential and what's not essential anymore, and whether these trends will remain, you know, as we go on after post-COVID, and even, you know, talking about mobility, like what does that mean for mobility in the future as well, and maybe an opportunity, as you mentioned, to you know, to solve in a way the traffic and the congestion issues of Lagos by reorganizing mobility around the city. Very, very, very interesting, and I'm really happy to see that your team was able to, you know, work from home, because again, we saw, for example, in other places in Africa, although people wanted to work from home, they didn't have the infrastructure, right? So you need to have, you know, internet connection at home, you know, et cetera, which was very interesting for some of these businesses that are doing last mile installation for internet, right? So again, you know, as you said, it's a mixed blessing, right? COVID, you know, depending on, you know, how you look at it. I'm really glad that you brought those two aspects, because we always talk about the bad things about COVID, but I think, as you rightly mentioned, it's both end. So in terms of, you know, we now in COVID, and, you know, as a company, you know, you have to stay relevant, and you have to, you know, continue to operate within COVID. So as an executive, like, what information or data do you use to make sure Avon stay relevant to, you know, your customer, to your stakeholders, you know, during this pandemic? We've seen examples of company, you know, you mentioned that earlier, having to reorganize their manufacturing to basically direct some of it to PPE, for example. We've seen example of companies that are in the delivery space, but delivering flowers that move to deliver food to stay essential and relevant, in COVID. So in your case, and for Avon specifically, but also other company, in Nigeria, what do you see?
Yeah, I mean, companies did various things. In Avon, the very first thing we did was actually information. Because in the beginning, most people simply did not have enough accurate information to help them make decisions or to even get a sense of what was going on.
Yeah.
And we have very quite active and engaging social media handles. And we have large communities on those handles. And we also have quite a vibrant website as well. So we told ourselves, look, if this is the way we contribute initially, this is what we're going to do, and we're going to do well. And we also have a blog on our website. So we just made sure we had a team that their work was you scan the World Wide Web and provide information that is witty, bite-sized, accurate, and up to date. Very succinct, very precise on a daily basis about COVID. And we discovered that all the numbers just went through the roof during that. We had quite a large number coming in just to know what was happening. What is this really COVID? Is it true that, if I share a cup with someone, is it true that if I drink hot water and put some salt in it, I won't catch it? Is it, there's so many
something basic,
crazy
but very,
things
going
on in the beginning. So that was the first thing that we did. And because we also have quite a large number of people who are enrolled onto our health plans, our call center, we also made sure that we retrained all the agents that work in our call centers and had them given fact sheets from which they could give yes or no answers, standard Q&As, all of that. So they were all equipped with information that they could give people and give some reassuring answers and provide them with facts, that would dispel rumors and myths around COVID and make sure that people were adequately empowered to go about educating other people in their own communities as well. So that was one thing that we did immediately that we thought would be helpful to the community, and it was. Another thing that we also did was that we decided also to start Avon Teledoc, telemedicine.
I see.
So already as a health insurance company, we have a department of doctors and nurses who do case management. When there was no restriction on movement, most of them were going out to hospitals that had our members on admission and doing case management at those hospitals. Now, because of the restrictions, they couldn't really do that as much anymore. So we just told the doctors and the nurses, we are now going to offer telemedicine services, and we put together the right infrastructure and worked with, I can't remember, I don't want to give anybody free advertisement, but we worked with the telecoms company and put together a remote call center infrastructure that enabled our own in-house doctors, as well as a number of other external doctors who we paid to offer telemedicine services. And that included consultations on people who thought they had COVID, who we always referred to the National Health Center for COVID for tests and their subsequent treatment, and that was very helpful because they didn't have to pay for those consultations. Absolutely. All of those were free, so that was something else that we did. And I mean, the reaction to that, as you can imagine, was really good as well, because I mean, they didn't have to pay for it. They just needed to dial in and get to speak to a doctor. So I remember this too from the top of my head. I had three. One seems to have escaped my mind all of a sudden, but if I remember in the course of the conversation, I'll come back to it.
But the second one is a great example of how you build brand equity during a pandemic, really, right? And you would think customer will remember. I mean, your.
Yeah, I've just remembered the third one. I remember the third one. Because we realized that staying at home was affecting people's mental health.
Very good. Okay.
We then got together with a couple of the psychiatrists that are on our hospital network. And we started developing health talks around mental wellness. Wow. And listening to ourselves. I mean, I would be the first person to admit that staying at home for that length of time also affected me. It affected everybody.
Yeah.
You know, not having the regular social interaction that I was used to at the normal levels with the amount of people I was used to having it with. And being in such close contact with the same persons day in, day out. You know, it's and not being able to go out, not doing, I mean, I do yoga. I couldn't do that with people. I don't like doing it with YouTube. Sorry, I really don't. It was horrible.
No, for sure.
You know, so I knew how I felt. And we started getting calls from our corporate clients whose staff were on our health plans that, look, we have staff who are breaking down. We have staff who just call and cry and don't stop crying. People need help. And so we just got together with a couple of our doctors who were psychiatrists within our network and said, look, we have this problem. We have it with ourselves and we have it with the clients. And, you know, they got together with us and put some health talks together. And after listening to a number of people, we started offering it to our corporate clients as webinars. And those were so well received. Of course, we also put in place, you know, a means of them to ask questions directly to the doctors who were on air, and they could do that and get answers. And if they wanted sessions too, actually their healthcare covers a number of consultations.
And again,
so that was
the relevance of having a healthcare coverage, right?
Of course.
And again, you know, it's very interesting because so we've asked people about their priority, you know, over the next, you know, 3 months in the mix of this COVID. Mental illness mental health came third.
It has to.
Yes. The first one was, you know, obviously staying healthy. And the second one was, you know, making enough money or staying at least afloat. The third one was really around
health.
Stress. Yeah. So
I don't think most of us realized how fragile
we
really were mentally until COVID-19 happened.
Absolutely. And it was such a big disruption in our daily routine that, you know, it really, you know, so, I mean, and I really like how, you know, your company and then your team went about it and really looking at all these different angles by looking at, you know, yourself as individuals and say, okay, you know what, if we have these issues, probably our, you know, clients or users would have these issues. So what do we do about it? And how quickly, you know, you're able to look into how you put infrastructure to get that going, leveraging technology and all that. So I think very, and one other thing, I don't know what you think about that, in COVID that struck me was, you know, the fact that it's an issue that's affecting, you know, the entire planet. And for once, we were all stuck and trying to solve the same problem. Doesn't matter where you are, you know, you were all looking at, okay, how do we solve this problem? Which I thought was also something interesting about interesting about COVID.
It was profound because all of humanity was going through the same problem at the same time.
And I remember one data point that struck me, for example, was we looked at our consumer sentiment index, and so we compare, because we use the same methodology as, you know, in the US. We compare consumer sentiment in the 7th country that we track, including Nigeria and the US. So for the 4 years of historical data that we have, tracking both indices, for the first time, they both converged in May.
See?
So you know, when we talk about the big reset for COVID and how basically, to me, that was, you know, like interesting, right? Like for the first time. And when you look at the economy and what happened in the US, you can understand why. Because again, the same thing where, all of a sudden you have 43 million people losing their jobs and, staying at home and etc. So very, very interesting dynamic happening with, with COVID.
It did.
So, I mean, looking at now we know, back then we thought, we're going to find a vaccine quickly, or
we thought
maybe
it was 2 months, 3 months, and it's over.
And it's over. Or maybe the heat was going to solve the problem in Africa, but we know it didn't. So now we are we have to live with COVID, at least for the foreseeable future. And again, there was this concept about pre-COVID, post-COVID. What's the new normal?
Yeah.
So what does that look like for you and for Ava? What's the new normal? Like looking up, we as a business, you almost, I don't know what's your reporting cycle, but you're probably now down to your fourth quarter, starting your fourth quarter of the year.
Yeah.
Looking ahead for 2021, what does that look like?
I can tell you the first thing it looks like is more investment in automation and digitalization.
Mm-hmm.
That's the first thing.
That's the first thing, yeah.
Also, more investment in upskilling and redirecting people and making sure everyone is multi-skilled.
Yeah.
And empowering them to be able to work remotely. More efficiently remotely.
Yeah.
And ensuring that their bonds to the company become less and less tangible and physical. I don't know whether you understand what that means.
Exactly, because it's the future of work. Our relationship to our...
Thank you. Right? You just used the word I should have used. That the relationships are now not based on tangible
things anymore. Yes.
The relationships have to be based more on, an alignment of purpose and view of the world and what we want to achieve and all of that, and less on how much I pay you and where you physically come to work and the perks working with me and all of that.
Yes. And it's I mean, I think it's going to be very profound. Probably one of the biggest change I see in Africa, because there's such a big resistance. I mean, our understanding of work. I mean, even in the West, to be honest. I mean, they started, looking at remote working a long time ago, but it wasn't even to the extent that COVID pushed them to go through, right?
Yes, indeed.
And because of that, as you mentioned, it's so profound, and I'm really looking forward to see how company really adjust and implement that. I was talking to somebody else, another executive who was talking about, moving from physical presence to outcome. And you mentioned that earlier as well.
That's what I
don't
said.
see you, right? I don't see you, but I need output, right? And so
that's all.
Exactly. Like, to me, that is the so that's okay, very good. And what about from a healthcare perspective, how does what's the new normal now? Or
from a healthcare perspective too, I think that, like I said, what I'm hoping to see is that across all the other parts of the healthcare value chain, I want to see that divergence also begin to happen more between healthcare and technology and the digital world. Many healthcare facilities in Nigeria for certain, and probably in many parts of Africa, are still so manual. Records are still being kept manual. You go there and they bring out files, paper files, and paper and sheets of paper and start taking records. Many. I'd like to see us all moving away from that. I'd like to see, healthcare service also being delivered virtually to remote areas. I'd like to see health education being delivered in communities digitally, virtually, and I'd like to see more use of that in changing behavior at the grassroots level. You know, also we talk about universal healthcare, and that is central to what we do as a health insurance company, as an HMO. And universal health coverage is an ambition that we have, and that's why we exist. We key into that as a vision. And in order for that to be achieved, I mean, it really breaks my heart every time I see a news story about somebody that couldn't afford the healthcare services they needed, and therefore they died.
Yeah.
We all have to move towards where everybody gets used to contributing a proportion of their income towards a pool that everybody else can have access to. But until everyone begins to take their health seriously, and know that no matter how little, you know, I contribute, it's towards a bigger pool, and that my ability to take away from that pool doesn't necessarily have to be directly proportional to how much I put into it. I can put how much I can afford to put into it.
Yeah.
You know, and I think the whole transparency of how that structure is set up and managed and utilized also has a lot to do with, you know, how much technology we utilize, how digitally and how connected the entire healthcare space is. We need to get the healthcare ecosystem connected.
Yeah. So it's a stronger call for digitalization, you know, on the continent.
Yeah.
What window do we have? Because we know to get there, you know, we've now in the midst of the pandemic, everybody knows we have the perfect business case. If anybody was doubting the importance of digital in Africa or was being lazy about it, we now have, and we're in the midst of a giant experiment that basically shows, you know, why this is important. How much window do we have so that, you know, if we find a vaccine in January, you know, by June next year, everybody forgets about it, because, you know, we all go back to our, you know, daily life. Like how do we make sure that, you know, we continue to drive this so that we actually see the change, we see the infrastructure, we see the investments, you know, we see that actually turning into impactful, because pandemic come and go, and, you know, we tend to be forgetful. So
true.
What's your sense?
I think, and I'm going to talk about Nigeria and Lagos State now, because it's the environment in which I'm most aware of how much progress has been made since the pandemic started in the area of digitization and data collection and aggregation. I know a lot has been done nationally, and at the federal level, but I'm aware of how much Lagos State in particular has been able to do, and it's quite impressive. And I know that there is a window to do so much more in the next 12 months. I know that the network that has been established through the Lagos State owned and run and managed testing centers, as well as the private accredited testing centers, and then the healthcare facilities that are also accredited to take care of COVID patients, as well as the public healthcare. They all have electronic records. They all are digitalized to a very large extent. Their data are visible and transparent and are being aggregated. By the time the vaccinations come and you make it mandatory,
you have the way to.
You have a way to compel. And then you can then just start rolling it forward from there on. You know, so I do think it presents a very good opportunity. You know, And there are also many other ways and incentives with which to just kickstart this, even if it's just from very simple, basic electronic medical records.
Medical records, yes.
You know, then we can talk about a switch or an exchange between the health care facilities and the HMOs, health insurance companies like ourselves, where the data visualization then comes to, and then the Ministry of Health. You know, we have to find some way to start aggregating all this data and making them speak to us.
Yeah. That's very, I mean, it's, you know, we hope that we learn from this pandemic, as you rightly mentioned, that we take the steps to improve healthcare system for, you know, our users and our people. And, you know, when you think about, what's your sense then, before we wrap up, in the next 12 months, as you rightly mentioned, what do you want to see happening? Do you want to see more, obviously a vaccine? Do you want to see more, engagement from, various stakeholders? How do you know, for your industry, we are moving into the right direction? Do you want to see less cases, in Nigeria, more testing, for example, in Nigeria? So what will give you a sense that, we're moving towards in the right direction?
As regards to COVID specifically?
Specifically, yes.
Yeah. Well, I think it's definitely more testing and less positives. More testing as a percentage of the population. Less positives as a percentage of the testing. Less hospitalizations as a percentage of both the population and the testing. And less fatalities, which is what we're seeing now, both as a percentage of the testing and as a percentage of the population. You know, so those are good indicators to show us that we're moving in the right direction. Yeah, and you know, it does look like it's moving in the right direction even now as I speak, but not, I mean, just because the ratio of number of tests to our population is still pretty small.
Still pretty small, yes.
Yeah, one is hesitantly hopeful, cautiously hopeful. Cautiously hopeful, I think.
Yeah. And we have a lot of cases that are, asymptomatic, as they call them, right? So you also have that, that challenge.
Exactly, and one is reading now that those asymptomatic cases, or those with really very mild symptoms tend then to have some heart disease now.
Oh, yeah.
Yeah, you know, but they're not very quickly being diagnosed. I think the reason why they're being quickly diagnosed in the US now is because the football playing population, the athletes, those have to get tested. Their hearts have to get tested. So if they tested positive and they test their hearts, and they see all this, these problems going on with their hearts as a result of having been infected, albeit in an asymptomatic manner or with very, very mild symptoms. So that's even more cause for worry.
One last piece of advice for our audience here in terms of how you manage challenge and adversity, and how do you make sure it makes you stronger in the future?
Wow. How do you manage challenge and adversity, and how do you ensure it makes you stronger in the future? I think the first thing I would say is to hold on to the fact that it will pass. Just know that you can and you will survive it. I think that's the most important thing. Once you have that assurance, and that it's not even assurance, a belief, an unshakable belief. You have to have an unshakable belief that it will pass and that you will survive it. Be willing to accept that it will change you. It's if you are fighting it not to change you have a problem. You're not being realistic. All you need to do is to have that unshakable belief that you will pass and you will survive it. But acknowledge it will change you. That you'll be reformed through it in ways that are painful and uncomfortable. And embrace that. Accept that and embrace it. That pain, discomfort, inconvenience is going to happen and you will be changed. But also knows that on the other side of it will be a stronger, more resilient person who is now better equipped for the other future battles that are coming.
Isn't that a nice analogy to what happened when you are infected by a virus?
And
you develop antibodies. There you go. Develop antibodies.
There you go. There you go.
So again, thank you so much again. We're wrapping this up with I think a nice analogy on what we can learn from COVID and this virus, and we can become more resilient. Exactly. I really want to thank you, Ms. Ukiri, from bottom of my heart to join our webinar series. To our audience, feel free to reach out to us and ask us any questions. Don't forget to subscribe to our newsletter, and we will continue to bring you data insight that are relevant and timely for Africa. And it is important for us to continue to track what's happening with COVID and how it's changing people's and businesses on the continent, and make sure we get out of it stronger. Thank you very much, and we'll see you next time.